I think will have an important impact in the future. They give new options for our patients. One has shown an overall survival benefit. The other one has a trend toward an overall survival benefit. I do think we will have approval of both of these drugs in the future, and they will change the landscape of advanced or metastatic kidney cancer, and they will be used, first of all, based on these studies, in the second-line setting. The results of the METEOR trial are very interesting. In the METEOR trial, cabozantinib, which is a drug against VEGF receptor, MET, and AXL, often upregulated in patients who have failed initial VEGF therapy such as sunitinib, was compared to what is considered the standard second-line therapy, everolimus. And what was seen in this trial in patients with advanced metastatic kidney cancer was a 42% reduction in the risk of progression or death. And this is a very important result. At the median, the median progression-free survival was double that with cabozantinib as compared to everolimus. In terms of overall survival, there's a strong trend in terms of an overall survival improvement as well, but we need to wait for those results. Nivolumab, a checkpoint inhibitor, also showed positive results in the second-line setting after a VEGF receptor inhibitor. This drug, too, was compared to everolimus. And what this drug showed for the first time was an overall survival benefit in the second line. The median overall survival was 25 months. And this sets a new standard of therapy, having an overall survival endpoint in second-line therapy. I would expect in the future that the overall survival trend that we saw in the METEOR trial will turn into an overall survival benefit, and I would expect that both of these drugs will be approved. I think that their trials will be initiated and in which these drugs will be given in other settings, and we need to understand what is the best setting. Should these drugs be given in combination with other drugs? Should they be given in the adjuvant setting? What is the best sequence of drugs in which to give them? We have more options, and it's our job to figure out the best way in which to give these new drugs.